Hi, my name is Jasmine Brown, and today I want to be talking about the history of delivery and childbirth, and importantly, just what is a midwife and a doula, since they are one of the most important people in the delivery room throughout history, even still today. So, starting off, childbirth is a big occasion for anyone involved, whether it's the partner, doctor, midwife, doula, mom. It's a big deal for the baby even. Your whole world is changing for mom, baby, partner, and hormones are changing. Your mind and your body is not the same, and it's a beautiful and it's a terrifying experience. So starting off, I really just want to jump into what is a midwife and a doula, since I am going to be using these terms a lot. So a midwife is a medically trained professional. In history, they were usually trained by doing apprenticeships and studying under a long line of women who also helped in the delivery room. And so the importance of a midwife is that they are there for the entire pregnancy. They're there in the beginning, the middle, the end. As you transition into being a mother, they just kind of help you out and teach you different things like how to stretch your skin before giving birth, as well as herbal remedies that you can use that might help relieve any symptoms that you're having from your pregnancy. And it's just really cool. I think midwives are pretty important. Like, I think if I ever get pregnant. So doulas are a little bit different. Doulas, they don't have medical training. They are mostly there for the comfort of the mother during labor. So that'll be like, they might have a small prior meeting and just like getting to know, like talking about the due date and just kind of understanding like how pregnancy has been, if they have any symptoms, just kind of making sure like they're comfortable and that they kind of have things in place. I think the doula is mostly there for the comfort and just understanding, like having a well background story of the pregnancy, aside from the midwife, of course, but just another person who isn't physically helping you give birth, but is mostly there by your side, encouraging you, make sure you're okay, except for like a partner. This kind of hindered a relationship because doctors and midwives, doulas, they all kind of had a bit of a feud in the hospital. And it is still noted that today, like I've seen videos of like saying from midwives and doulas today, how they're like, oh, the doctors don't really like us when we come into the hospital. And I think that's just because of like a person who is medically trained for like 10 years or 15 years or whatever. And they have all this knowledge about a very specific thing. And then you have midwives who are mostly taught through like generations and like focus more on natural healing and natural birth. I feel like those two collide and it's just not a good mix. So a lot of women, after the 1970s, a lot of women started pushing back into giving home births because it felt more natural and calming than being inside of a hospital setting, surrounded by doctors, nurses, just ordering you around. So, two little fun facts that I found about midwives is that in the past they could be accused of witchcraft if any problems occurred with the pregnancy, which is just scary to think about since 1 in 3 pregnancies had a mortality rate in the medieval times. So, midwives are just thrown under the bus if any problems arrived with a pregnant woman or the baby, and it could have just been that the mother caught an infection because it was different back then and it didn't have the same resources. Another thing was that midwives could be a part of any social class like today. Women of all different social classes, race, gender, sex, sexuality can get pregnant. So there was no like class you need to be in to be able to have a midwife. Anybody could find one. And yeah. So the next thing I want to talk about is kind of why the mortality rate was so high for being 1 in 3. And this was just because of infections, postpartum hemorrhage, inexperienced midwives or doctors, obstructed labor were causes of death oftentimes. So women just didn't have the same technology that we do now. So like these things were happening, and oftentimes they didn't know the signs to look out for. Like there could have been a problem beforehand, but there was no way for them to be able to look at the uterus or the stomach just to see what was going on. So these problems did happen. So now I want to focus a little bit about the history of giving birth in different countries. So in Tudor England, 1485 to 1603, weeks before or after birth, mothers were shut off from a private room. This was called lying in. Absolutely no men were allowed in. And they basically just prayed over the women and made sure that everything was calm. And of course, they would have their doulas and their midwives in present, as well as a doctor standing close by. But they wouldn't have a doctor until like later on because no men were allowed in. But they would have somebody like a medical professional standing by to make sure mom was doing good after giving birth. Another country is Japan. And this was 794 until 1184. Aristocratic households had a birthing room, and it was typically in the north side of the house. Women were expected to be dressed in white, and childbirth was not as uptight there. It was more of like an entertainment for them. Birthing wasn't private. There would be a Buddhist monk, a female spiritual medium called a Miko, and they would just pray ghosts away because they believed that giving birth was almost like a near-death experience, and they didn't want any spirits to try to cling on to the mom and like have her die eventually. So the next topic I want to go into is just technology and how it has changed throughout the years, because I think this is a big factor into how pregnancy is not as much of a death sentence as it was before. And even though we still have a long way to go, because I do believe the U.S. has one of the highest mortality rates for women, especially Black women. So we do have a while to go and more to learn about all the diseases and symptoms to look out for to prevent mortality rates. But the biggest invention was the forceps. It was invented in the 18th century, and it was used to be able to help stuck babies in the birthing canal. And it just was a good thing to have because you were able to check your uterus better. But what came with the invention of the forceps is that women were not allowed to use them since they were considered a medical advice. And this is when male midwives started to come up, since they were predominantly before women. Male midwives were able to use them because they were able to study medicine and women weren't. So this kind of became like a male versus female rivalry in the midwife community, because women were not given the same privilege as men. So many women, this was around the time where many women began switching to male doctors because they were being checked better because of the forceps. And as medicine progressed, we eventually got the invention of anesthesia and more about how that could help in pregnancy. But before, anesthesia was used for pain relief, or it's still used as pain relief, but it was not socially acceptable because people believe that women deserve to have pain when giving birth, since it related to God and a story of Adam and Eve, and that it was Eve's punishment for disobeying God. So they believe that this was a woman's fault and she deserved to have pain for childbirth to please God, to make God happy. So it's said that Queen Victoria actually used chloroform during pregnancy, which I think is kind of wild because that is a lot to be inhaling when you're pregnant. But yeah, that's just kind of a little fun fact, I guess. But yeah, after the finding of anesthesia into the 19th century, doctors began making antiseptic and hygienic products that could reduce death from surgery and infection. and this was making it more possible for C-sections to be performed. So C-sections were a thing prior to the 19th century, but it was more if the woman had no choice and there was no hope left for her. That's when a C-section was given. So now that they were able to have cleaner products and like had antiseptic products, they were now able to comfortably give C-sections when needed to prevent further from a mortality rate in mom and baby. So doctors cause more deaths than midwives, as a fun fact, I guess, because they weren't washing their hands. Doctors were very messy, and a lot of women didn't trust doctors after a while. So with everything I've said, the invention of heart monitors, vitamins, ultrasounds, today we have way healthier moms and babies. As I said previously, we still have a while to go, but these have all like helped the mortality rate in general for women who are pregnant. And so by the 20th century, women were able to study medicine, so they were able to take their teachings from past generations as well as use medical devices now that they were able to study. So taking a little bit back real quick to 1970s, home water births and natural, more comfortable spaces were promoted because people weren't liking the environment of hospitals. Hospitals were just sad and gloomy. They didn't really listen to you or your needs. You were just another patient, and it was just like an in and out thing. And so women felt more comfortable and being more natural and confident in their bodies, of course, with the 70s. But it was a big thing. And I think it's important because birthing centers, doulas, midwives are all used today. And that is thanks because of the women before who pushed for this change. And so lastly, I want to talk about midwives and doulas today and just the hospital setting today a little bit more because today we do have more male and female midwives and doulas, and they help in hospitals, at home, in different situations depending on what the mother wants. And it was noted in an article by Dustin Young, as I mentioned earlier, who his sister was giving birth, and the hospital, he realized, was just not understanding like how big of a deal it was, or like if they did understand, they weren't showing it, and it was just to do this, do that, and it was just not a warming environment to be in when you're about to give birth. So he decided to become a doula to help women like navigate the birthing experience and for them to have a better, more pleasurable experience in giving birth to a whole new life. But yeah, so thank you for listening in. And yeah, have a good one.